Liposuction has been around for a long time and it's had a lot of advancements through the years. Nothing, however, is without some degree of risk. So we can start with those things that we consider risks starting at surgery, and we'll work our way through the recovery and see if we can't cover all those things. When you have surgery, it can be done either under anesthesia or it can be done under local without any type of sedation. Now the problem with that is it's hard often to get a good result when you're just doing it with local anesthesia, and it doesn't mean that there aren't risks. So people that have it under local might have excessive pain. They still could have things like bleeding. You can still have the other complications that we'll get to, but the only thing you're really getting past are the risks of the sedation itself. In that case, along with the other types of liposuction, there can be some complications that are due to the local anesthesia itself. There are certain limits that you should have. And when that's your sole method of applying the anesthesia, it is possible that you could get a little bit too much. So we always want to be aware of how much local anesthesia you're getting. And we calculate that based upon your weight. And there are really good formulas for us to know this is definitely a safe amount to give. That's been studied for a long time, so we have that. So that's kind of at the surgical and the anesthesia time. There are the risks of bleeding, but the way anesthetic is done today with the local, in addition to the other sedation, the amount of bleeding is very small relative to the amount of fat that's removed. When I started in practice and training over 20 years ago, almost a third of what was suctioned out actually was blood. So you were limited and you couldn't remove more than, a liter or two, because that way you would only lose like a unit of blood. Now it's about 1% of what is suctioned out. So it's a lot less given the proper techniques. So we're really happy with the way that has progressed. So bleeding, or the amount of bleeding, has become a relatively infrequent complication. Infection, always a risk. Anytime you make an incision on the body or the face, there's a risk of infection. With liposuction, again, that's relatively small. In our own patients, they get IV antibiotics at the time of their operation, as well as taking antibiotics after surgery, which helps keep the infection rate low. You want to make sure you go to a place that has good sterilization, good technique, and is properly certified, and that's going to help decrease that type of risk of happening. Then there are the more common things that maybe are not quite as bad. A bit of a contour irregularity, meaning a little bit of extra fullness in an area, or perhaps a little bit of a hollowness in an area. When it's just a little bit, that's very manageable afterwards by just taking a little bit more fat out, perhaps in a small touch-up procedure, or grafting fat back into an area. We unfortunately at times do see people who have had liposuction in some places where they've been too aggressive, and that's led to a lot of irregularity. So you see somebody's abdomen that's been over-suctioned and it looks like it's cobblestones because it's just so wavy and irregular. Too much was taken in an effort to maybe get really thin, and maybe that's where the patient was wanting to go. But as long as you're educated ahead of time on about how much properly can be done, that can also be minimized. So when I generally go through my list of complications on any surgery, I like to think of them to make sure I cover it with a patient. Bleeding, we've got that. Infection, changes in sensation or loss of sensation, very unlikely with liposuction. Usually sensation changes are temporary. It would be extremely unusual for anyone to have any type of chronic pain after liposuction, but it is a remote possibility. Some nerves could be bruised or injured and just never quite come back all the way. So that's really, really infrequent, but possible. Contour irregularity or waviness just depends again upon the vision and skill and the communication, I think, of the surgeon you're working with. The risks of little nodules or things underneath the skin, well, that's not really a complication because they do go away. It's a deeper bruise, and those things soften and get better with time, and very rarely require any type of additional treatment. And then the anesthesia that you're getting, whether it's local or it's general, or if it's a combination of the two, each are going to have some risks that go with that. Go ahead and hit the like button if you enjoyed this video, and feel free to share with a friend. You can stay up to date with the latest in cosmetic surgery by subscribing to the Austin-Weston YouTube channel. And for more information on the Austin-Weston Center, visit our website at austin-weston.com or click the link in the description below.